This is Graham. He can use his brain to send WhatsApp messages and even emails without typing or clicking. And you might be wondering, what kind of telepathic magic is this? Well, Graham suffers from ALS, the same condition that Stephen Hawking had. This disease is where the nerve cells in the body break down. This means that Graham struggles with daily tasks that you and I both take for granted, like getting dressed, going for a walk, and even communicating. But now, thanks to a brain-computer interface, or BCI for short, Graham's life has significantly improved. In the future, we can expect to see more of these devices helping people who are suffering from ALS and paralysis to those who are born blind and want to see. In this video, we'll dig deeper into these seemingly telepathic devices to actually understand how they work and discuss when they might be a part of our healthcare system. But let's take a step back. What exactly is a brain-computer interface, or BCI? Essentially, it's a system that allows communication between the brain and an external device. Think of a BCI like a translator. This translator can understand the language of your brain and convert it into commands that another device, like say a computer, can actually understand. Here, Graham is using a BCI from a company called Synchron. And this BCI is called a stentrode. Essentially, it's a set of electrodes inserted into the brain through what's called the jugular vein, which is on the side of your neck. This vein acts as a passage to guide the stentrode into the brain. Once in the brain, the stentrode is positioned next to the motor cortex. This is the part of the brain that's responsible for movement, so it's a perfect place for the stentrode to pick up signals about intended actions. These inserted electrodes act like sensors, recording the electrical activity from the brain. These electric signals are then sent out of the brain through a wire into the body and into a separate device implanted under the skin. This unit wirelessly sends the signals to an external receiver. Once the receiver has this data, it sends it to another external device. In this case, a computer with custom software that can actually understand these signals. And the software on the computer can convert these signals into actions. So now the computer can perform actions that the brain wants to perform. So for example, if Graham thinks about moving his finger to click the send button on an email, the computer can translate these thoughts into action, like pressing the send button. Think of this as a remote control for your TV. In this case, the remote control is your brain and the TV is the computer. The fact that two people who suffered from paralysis were able to use this device for their benefit is already a big thing. And there's even more good news for Synchron. This year, they got the green light to test their BCI on more human patients. But there are a couple of concerns worth mentioning. Any procedure involving blood vessels does carry the risk of bleeding. There could be a risk that insertion of this BCI might actually damage blood vessels in the brain, leading to bleeding and long-term complications as a result. While their BCI is designed to maintain blood flow in the brain, there still may be a chance of blood clotting. Any complications with the procedure could result in the patient maybe suffering from a stroke later on. Further studies on more patients will shed light as to how big this risk is. Now, the Synchron system requires a stentrode, a device inside your chest, an external receiver, and a computer for all of this to work. You could argue that's a lot of devices. But Neuralink, a company founded by Elon Musk in 2016, is approaching brain-computer interfaces in somewhat of a different manner. Say someone is paralyzed. This could be, say, due to a spinal cord injury. The nerve cells, which act as a highway for delivering messages from the brain and to the muscles, is damaged. But this Neuralink system will create an imaginary bridge over this damaged highway. This means it can allow a patient to move, even if they are paralyzed. The Neuralink system takes signals from the brain, translates them into a form that can be understood by an external device, and then deliver these signals directly to the muscles. Neuralink will insert what they call a link into the brain. The link, also known as the N1, is about the size of a quarter. The N1 contains ultra-thin threads, with each thread carrying multiple electrodes. And to be precise, there are 64 threads carrying a total of 1,024 electrodes. These electrodes are the actual devices that record the activity in the brain. So by placing many electrodes on a single thread, the link can interact with many tiny messengers in the brain, also known as neurons, which send signals. Because many of these tiny neurons interact with each other at the same time, the link can get more of an accurate reading of the signals that they generate. So in simple terms, more electrodes mean a more accurate understanding of the brain. Now the N1 is inserted into the patient's brain using a precision robot called the R1. And the whole process of insertion just takes 15 minutes for this robot to do. So the first set of electrodes are placed in the motor cortex of the brain. When tiny messengers in the brain, or neurons, are active, These spikes are detected by electrodes in the brain. So for example, if a human decides to move their left leg, a specific group of neurons within the motor cortex will fire in a particular pattern. So one pattern may, for example, correspond with lifting the left arm, and another pattern may correspond with moving the right leg. Now these spikes need to be translated into commands a set of muscles, like those in the leg, can actually understand. So a process known as decoding takes place. Decoding is just like translating a foreign language. If the brain signals are in French and the spinal cord device only understands English, the decoding process is like a translator that converts the French into English. Once these commands are decoded, they're sent to or streamed to the second device in the spinal cord. It's streamed wirelessly using Bluetooth Low Energy, or BLE for short, at a speed of around 10 bits per second. This device in the spinal cord would then be able to understand, say, needing to move the right leg. To be a tad more precise, this second device is next to the lower motor neurons, where it's able to stimulate them. So when these neurons are stimulated, it causes the correct set of muscles to contract. But the brain also receives feedback about how the action is being carried out. For example, we change the way we grab, say, a hot coffee mug. That's why the Neuralink device can also record sensory information related to the movements. So that was a lot of detail, so let's just zoom out for a moment. The use of just two devices, without any long wires inside the body, does make Neuralink's offering rather streamlined. And basic actions like walking can cause your brain to jiggle a bit. Traditional brain implants are quite rigid and don't move with the brain. This can cause them to rub against the soft brain tissue, potentially leading to inflammation and even scar tissue. But Neuralink's threads, on the other hand, are quite flexible. This means they can move with the brain, reducing the risk of damage. Imagine the brain is like soft, wobbly jelly and the threads are like spaghetti strands. If you put a rigid stick of spaghetti into this wobbly jelly, there's a risk that when the jelly moves, you could actually pierce it. But if you put a flexible strand of spaghetti into the jelly, when the jelly moves, so does a thread of spaghetti, reducing the risk of damage. Some companies like Neuralink will look to drill a hole into the brain and then insert the BCI. And many companies involved inserting a wire several centimeters into the brain, just kind of hoping they don't hit a brain vessel. Instead, Neuralink uses threads and needles which are order of magnitude smaller. The threads which contain the electrodes are extremely thin, about the 10th the width of a human hair. Coupled with the use of the R1 to precisely insert the BCI into the brain, it means that there's real precision to avoid hitting blood vessels. And let's just say worst case they did hit a blood vessel in the brain. Because the threads and needles that they use are so small, there isn't actually any concern of damage if there is a cut. Like Synchron, Neuralink have also demonstrated an ability for telepathy. Here the monkey called Sake has a Neuralink inside of its brain. It's using the Neuralink to type on the computer without physically touching any keyboard. The monkey's moving the cursor with its mind to the highlighted words. Now even though Sake isn't actually coming up with the words himself and just clicking on the highlighted words on the screen, this technology should be evidence that it could help someone that is severely disabled with being able to communicate with other people. But even more, they could go online and do things on the internet like, say, work. If only we had these devices earlier, we might have been able to see more of the iconic Christopher Reeve, the man renowned for his role as Superman. Given the promise that Neuralink offers, it shouldn't come as a surprise to learn that they've received approval from the US Food and Drugs Administration, or FDA, to conduct their first set of tests on humans. But you still might be wondering, how far are we from actually seeing these devices being used by hospital patients? And the answer to that does depend on how effective and safe these devices actually are. Different countries regulate BCIs differently. In the US, the FDA would be the regulatory body because they oversee both food and medical products. And they're going to want answers to questions like, are the materials which make up these devices safe from overheating? The general process of FDA approval does involve several steps. Before any testing can be done on humans, there needs to be pre-clinical testing done, for example, testing on animals. Only once this has been evidenced as safe and effective can it move to the next stage, called the Investigational New Device application, where they submit their results and plans for human testing. If this is approved, then clinical trials on humans can begin. This third stage is where Neuralink is at right now. In the space of just 7 years, Neuralink has gone from idea to human testing, which is pretty cool. As long as it shows safety and effectiveness consistently, they'll be able to test on more and more human patients. If all goes well there, they'll be able to seek pre-market approval where, in layman's terms, they work with the FDA not just to submit their human results, but also work with them on getting the warnings for the device right, things of that nature. only once this data has been approved will the FDA allow for the BCIs to be rolled out to the masses. So based on everything, when will, say for example, the Neuralink be made available for rollout in the US? It's hard to say for sure, but if I had to guess, I'd probably say something like the next 20 years. But for all the promise that these kind of devices bring, what are some of the concerns we should be aware of? Well, one of them is long-term biocompatibility. Long-term implantation of these BCIs could lead to things like inflammation and even infection. Also, our human brains are a lot larger and a lot more complex than the animal brains that have been tested on, like rodents and monkeys. While there are many similarities between their brains and ours, the human brain has a lot more neurons and a lot more connections. All of these contribute to our advanced cognitive abilities, so it may mean BCIs maybe aren't as effective on humans, which could in turn slow down its progress. And looking further down the line, as these BCIs get more advanced, companies could potentially collect very sensitive data about our thoughts, moods and experiences. How will it even be stored and protected? Is there a risk of hackers getting into it? Could it be sold for advertising or even given to the government without our consent? But like all my videos, despite the challenges that lay ahead, I think it's really important that we don't lose sight of the benefits. Take Fraser for example, a 17-year-old kid who fell down a 20-foot cliff.
You've got an injury in your back, and I know you knew from the moment you fell that you couldn't move your legs, basically. The impression with that is that that would be permanent in some way.
Why does this condition have to be permanent? With the use of brain-computer interfaces, Fraser and thousands of people around the world wouldn't have to worry about this, from paralysis to Parkinson's, and even mental health conditions like depression. These devices could undoubtedly turn people's lives around. What if, with brain-computer interfaces, those in the world who are suffering the most could be able to shine the brightest light for the rest of us? While there is still a long way to go, I'm very optimistic about the future of brain-computer interfaces and all of its potential. My friend, thank you for watching.